Over the past several decades, my research team and I have been involved with developing and testing interventions for incarcerated parents and their families. This work originally started when the Oregon Department of Corrections invited a group of us from the Oregon Social Learning Center to be involved in thinking through potential interventions in a new prison that was being built for women outside the city of Portland, where it would be much easier for families to come see their loved ones who are in prison. We developed and tested a new program for incarcerated parents called Parenting Inside Out. The Parenting Inside Out program is a parent management training program that was informed by decades of research at the Oregon Social Learning Center and other universities and research centers around the country that have been striving to develop evidence-based programs that prevent the development of conduct disorder. We eventually received funding from the National Institutes of Health to study the impacts of the Parenting Inside Out program, not only inside prison, but also after release from prison. In fact, up to 1 year after release. And we found positive impacts not only on the functioning of the parents involved in the study, but also the relationships that they were having with their caregivers of their children and with their children. After release from prison, we found the group that was randomly assigned to receive the program had less contact with the police and reported less antisocial behaviors after release, as well as using less substances. The findings from this study have influenced work across the country in a number of other jurisdictions, and the program today is used in over 30 states and 3 countries around the world. So 2 of the most important skills in Parenting Inside Out are speaking and listening. An example of how important these skills are was a father who was estranged from the caregiver of his child, so he had no contact with the child and wasn't able to talk to the child on the phone, didn't see the child in visits. Over a period of months, he practiced these skills actively with the caregiver and was able to have conversations that he had not had with her for many years, and eventually this led to him being able to talk to his child on the phone, to see the child in a visit, and after release to be able to have communication with the child in a way that just hadn't been possible for many years.